So children need a liver transplant for a variety of reasons. The most common reason is a disease called biliary atresia, where the children are born without properly functioning bile ducts and therefore an inability to drain bile from the liver. Other disorders include rare genetic disorders and autoimmune disorders such as autoimmune hepatitis or primary sclerosing cholangitis. And in some instances, previously healthy children rapidly develop acute liver failure and need a liver transplant immediately. So in general, there are two options. First, and more commonly, the child can be placed on the wait list, waiting for an offer from a deceased donor liver. Second, a living donor, such as a family member, can donate a portion of his or her liver to the child. With living donation, the transplant can occur at a time when it's clear the child needs a transplant, but before the child becomes extremely ill. This means that the child will not die while waiting for a liver and will likely have less morbidity prior to transplant, including less hospitalizations. So outcomes following living donation and deceased donation are great. The 1-year survival is about 90%, and the 5-year survival is about 85%. In general, outcomes following living donation are slightly better than those for deceased donation. Only healthy adults can be a donor. All potential donors receive a comprehensive history, physical exam, psychological evaluation, as well as extensive blood work and imaging. An important part of the donor evaluation process is also that they have a separate medical team, as well as a donor advocate there to make sure that the donor's interests are being served. Johns Hopkins has been a leader in living donation and was one of the first centers to utilize this procedure. Recent research has focused on understanding barriers towards living donation in order to improve its use in our pediatric liver transplant community. We've also developed several apps or digital tools to help our families, including an app to help diagnose biliary atresia, the most common cause of pediatric liver failure, earlier in our patients, as well as other apps to improve communication between family members, as well as improve communication between family members and healthcare teams in order to better help this population.